Hi, everyone. So I'm Christy DeLuca. I'm a speech language pathologist and the owner of Speaking Boldly. And I just wanted to get on here and share my story, share a little bit about my journey, my story, how I became a speech language pathologist and voice therapist, and really why I became a voice therapist and speech language pathologist. So many of you may know this by now at this point, but so I am a speech language pathologist, but I also have a voice disorder myself. So it's a chronic neurological voice disorder called spasmodic dysphonia. And this I've had for about 10 years at this point. So this has been really my major driving force into why I became a speech language pathologist. And it was my own experiences, so what I went through having a chronic neurological voice disorder, what I still frequently go through, um, the frustrations of it, the daily kind of challenge of living with a chronic voice disorder. All of those things both have shaped my decisions, um, the path of my life, and also my views, the way I see things, my perspective, and then who I am as a speech language pathologist and what decisions I make and how I think about how I'm treating a patient, or how I'm treating somebody I'm working with. That is all completely shaped by the fact that I have a neurological voice disorder. Part of that is what I went through, and again, what I still go through as a patient. So I still am a patient, right? So I'm on both sides at this point. So I am a patient of, somebody who has a chronic neurological voice disorder, and that will be forever because we know that chronic neurological voice disorders are incurable. So that's something like tremor or spasmodic dysphonia. But the other piece of this is I am also a speech language pathologist. So I have a very, very interesting perspective in the fact that I'm kind of on both sides of the fence. And so I've gotten to learn a lot of insights by being on both sides of things. And I think that, I can relate to most people who have a chronic communication disorder. And I'm not saying that I know exactly what you are going through because I don't. And everybody's journey, everybody's experience, no matter whether you have something like aphasia or dysarthria, any other, neurological impairment, or whether you stutter, or whether you have spasmodic dysphonia, or maybe even just another voice disorder. I don't know how impairing that is to you. And I can't know until we have those conversations. But those are the conversations that I have with my patients. And those are the conversations that I feel like leads to doors opening and progress. Now, I've never been the type of therapist who says, this is what we're doing, X, Y, Z, let's go, let's do the drills. I have been on the other side of things. I've experienced professionals in the field who are like that. And I've also experienced professionals, as a patient, right, who are also like that. And from my perspective, at least, it's so helpful to talk with the person in front of you. It's so helpful to view them as a person first and not a disorder. And that is one of my primary values and beliefs in how I am working with somebody with a communication disorder. They're a person. They have personal goals. They have daily frustrations. They have daily activities that they want to get back to. So that might look very different for me than it looks for somebody else, right? For me, it might look like wanting to get through my workday and not feel like I have vocal fatigue, or being able to socialize with people, not feel self-conscious, or be able to participate in a fast-moving group conversation and say what I want to say without being inhibited. or feel very confident when I'm speaking, when I'm having to do a presentation for work, or when I'm speaking on the phone and somebody asks me to repeat, that I feel comfortable doing that. So those are all sorts of things that I've had as goals, and I still have as goals, whereas somebody else might have very different goals. Someone else might have goals that look like, speaking with their grandkids and being able to read them a book without feeling strain, or that they just can't get through the reading, or being able to speak at work and not feel like it affects their job performance or how people view them, or their intelligence or competence. It may look like being able to socialize, being able to talk with your friends normally again, and whatever that means to that person in normal terms, right? That might mean without impairment. That might mean without feeling inhibited, saying exactly what you want to say without feeling like you have to work so hard or just give up on words because they're too difficult to get out. So I really delve into the specifics of what that looks like. And one of the questions I love to ask is, what would your life look like without this communication disorder? What would you do differently? What would you be able to do differently that you can't do right now, or that you don't want to do right now because it's just too difficult, or because it's too physically effortful, or because the voice or speech or words just won't support you in that? And then we work on setting specific goals. So I have a collaborative goal setting model where I ask the person, the client, what do you want to work on? What do you feel like you want to get back to? And then I obviously give them tools to be able to reach those goals. And we work on very specific steps to be able to get there. But the first steps are collaborative goal setting. I look at all different areas. So I look at the area of, activities and participation. How is that affected for you? I look at the aspect of psychosocial effects, right? So I look at the emotional impact that this is having on you, or how it's contributing to frustration. And we talk about that, and we figure out ways to lessen that. And we talk about, how it's affecting you in different situations. So maybe you're okay in quiet environments, but those louder environments are really hard. Or maybe vice versa. Some people feel better when they're speaking louder. So maybe it's those quiet environments that are actually more difficult. So we work on those. Maybe it is speaking in a group that just makes you feel really uncomfortable, or you can't get the volume that you need to speak up. Or maybe it's finding the right words. If you have something like aphasia, it's finding the right words. If you have something like a fluency disorder, like stuttering, it might be feeling comfortable with that stutter and allowing yourself to really own that, but how to get through that and how to still be able to speak to somebody when you know that something like a stutter or a chronic voice disorder or aphasia is not necessarily going to completely go away. So how do you compensate for all of those, and how do you work to be more efficient without feeling just defeated or frustrated? So part of my journey has been managing all of these symptoms myself and learning the ways to better compensate for it. So rather than pushing from my throat, how do I make my voice more efficient, rather than, feeling self-conscious of these little voice changes? How do I own it? How do I tell people about the voice disorder and learn to accept it rather than hiding it? I've learned, how to tell people about it, how to explain it, how to understand it better, what methods help me to manage different speaking situations. So how do I project without pushing? What tools can I use, like headphones or, microphones? What voice therapy tools can I use? Um, you know, how do I lean on those support systems that I have, rather than trying to just pretend that there's not a problem, or pretend that everything is perfect, right? All of these things I've worked through myself, and I've come, to change perspective a lot. And now I used to hide my voice disorder. I used to want people to think that I didn't have anything wrong and that my voice is fine, just like everybody else's. But it wasn't, and it isn't, and it will never be quote unquote normal, right? But I've found a new normal where no, it's not perfect. I struggle to get words out sometimes. I use effort some days. I feel like some days are exhausting when I have 7 hours of speaking, 8 hours of speaking, working with patients. Even when I'm at my best voice day, even that is hard. I'm doing a lot of things to be able to get by, but I'm so grateful to be able to do that and have the tools to know how to do that. And for me, it's been a lot of learning what works, what doesn't, learning how to make my voice more efficient, learning what strategies to compensate for the strain or the breaks, or learning what situations I need to just step back and maybe rest, or maybe explain it to people when I feel self-conscious about it in an interview, or when I don't know somebody as well, or when I'm on the phone and they can't hear me, or when somebody, asks me if I'm sick, which still happens to me occasionally. Those are things that I've learned how to manage. And I think my perspective has shifted because I've learned to, I know this sounds weird, but almost appreciate the fact that I've gone through this and had to deal with a chronic voice or communication disorder. And again, I know that can sound very weird, but I have dealt with the challenge, and the challenge I feel like often makes you stronger. If you accept that challenge and look at it that way, it can completely break you. Or if you work through that and learn different tools and strategies and perspective shifts, all of that, you can then start to look at it as something that can really build you and shift the trajectory in your life, but in a good way. So for instance, for me, it would have been really easy for me to quit everything, get really down, and say, I can't have a job where I speak at all. But instead, I decided to become a speech language pathologist, and I learned a lot about voice, and I learned a lot about the neurology behind it, and I learned a lot about perspective, and all of those things have helped myself, but also helped me help others. And that makes me feel empowered too. So I found a source of empowerment and control in the fact that I had this chronic voice or communication disorder. And that I feel like is so huge. So I want, people to start to think about how they can start to gain those sources of empowerment. Maybe it's volunteering with others. Maybe it's not even related to speaking, but maybe it's, developing something that can help others with communication impairments, or can help others with a disability. Or, maybe it's just finding your voice, quote unquote, whatever that means for you, when you don't have a typically functioning voice, right? Or speech, if that's your case. So I talk a lot about this with people I work with is, well, how do we shift this? How do we start to take a more comprehensive approach and look at this globally, more comprehensively, and target every aspect of this? It's not just working on the techniques and training and drilling. It's how do we affect change in all these different aspects of your life to really make a quality of life shift, a quality of life improvement, and decrease that handicap or impairment in quality of life. Because a lot of times we're dealing with chronic communication disorders, so we know that we can't get rid of it, and so that should never be the goal. With stuttering, with aphasia, sometimes you can make huge improvements, but for something that's never going to completely go away, we need a shift, and we need to make some shifts in making the environment less demanding, or shifting your perspective, or giving you tools to better compensate, or making you more efficient in speaking and communicating. Some of those tools might look like slowing down, using more breath flow, taking pauses, resetting, taking yourself out of a noisy environment, giving yourself confidence back. And when we talk about different ways to do that, finding sources of empowerment, sources of support, feeling comfortable accepting it. All of those things are part of speech and voice therapy and should be. The counseling aspect of it and how I am supporting whoever I work with in doing this, whether that's supporting them in saying, yeah, this is hard and it's not fair and it's a huge challenge. And this voice therapy, speech therapy is not easy, but you're doing it. And we're making these changes and you're seeing these little changes and it's a process, right? So those are the sorts of things that every step of the way you feel supported in. And so it's not just, okay, do this, do this, do this, and practice, and there you go, and you're off on your way. It's a constant support. I have email support always. Any questions, I'm writing long emails back to clients to really support them in the process because I've been through it. I still deal with all of it, so I know how hard it is and can be frustrating at points, but we work through all of those things. So I take a very life approach. So one of the things I base this off is, the life participation approach to aphasia, but also just my own research on psychosocial effects and my own experience with all of it. So I think me being a person with a communication disorder, I have such great empathy and a really unique insight into what others might be feeling with dealing with a communication disorder. And we always open the door for those conversations and never ignore them just because it's easier to not talk about it, right? We kind of tackle those barriers, we tackle those challenges, and even those psychosocial impairments, because that's a huge piece of all of this in this kind of rehabilitation and this progress. Not even rehabilitation always, but it's compensation and shifts. So that's my approach. And a little bit into my story, like I said, I've had this for 10 years, and there's ups and downs, but I've learned to, I would say at this point, it's efficiently managed for me in what I do. And I do a lot of voice therapy. I also get a low dose of Botox unilaterally, so one side. And I'm very open about that. I'm open about my backgrounds and my voice disorder. And I think that that's one thing that can be helpful in people that I work with too, and knowing that I get it. I've been there, I deal with all the challenges. But I will say that there is a light at the end of the tunnel. That if you're feeling hopeless or feeling like you can't get there, know that there is hope, because I've been there, I've been through it. And my voice was in the beginning really, really, really strained and difficult, and I couldn't get words out and I couldn't speak, and I just felt so sore by the end of the day, by the middle of the day, and I couldn't go out to restaurants, I couldn't hang out with my friends, I would make excuses to cancel plans, I would feel just down about my voice and not being able to say what I needed to say. I felt like my personality had changed because I wasn't social. I was more reserved, and I felt more self-conscious and lost confidence, which wasn't me. And slowly I started to get all that back when I had tools. And I think one of the biggest things was tools gave me control, and then it gave me confidence. And then I started to get these pieces back. And so I will say to anybody who's feeling hopeless that no matter what you have, whether it's a chronic voice disorder like tremor, spasmodic dysphonia, vocal fold paresis, right? Whatever it is, or if it's something like stuttering, or you feel self-conscious about your accent and that's really affecting you, or it's something like aphasia, post, traumatic brain injury or stroke, right? If you have cognitive changes, all of those things. If you have, primary progressive aphasia, if you have a progressive neurological disorder or disease like Parkinson's disease, right? All of this is the same underlying concepts, the same underlying issues and difficulties and challenges. So we, although that will look slightly different for whatever speech or voice symptoms that you're having, or language symptoms that you're having, we go about it in that same way. And I take my personal experience into account in how I'm thinking about how the other person's feeling when we're doing everything. And I tell people it's a two-way street. So if you don't want to do something, if something is not feeling good for you to be doing, or it doesn't feel natural, or it doesn't feel like something you are going to go out of the treatment room and actually use, we're not going to do it. There's plenty of tools that we have to choose from, that if something is just not working with you or jiving with your style, I'm going to forget it. And so I think that's an important piece too, and recognizing that therapy is never do this, do this, do this. Okay. And I'm directing. It's how does this feel for you? How do you notice a difference in your speech or your voice when you do this? Is this feeling better for you? Does this feel like something that you can use with your significant other, with a family member, or with a good friend? The answer to all that is no, or to some of those is no. We're going to shift. We're going to shift gears again until we find something that feels natural, feels comfortable, feels easy, feels like it could get speech and voice out easily. And that is something that can be done outside of the treatment room for carryover. And that's what we're always going for, is carryover. So I start with carryover day one, and we do conversation work day one. How are you taking what we do in little structured techniques and actually translating that to how you're using your speech, voice, language outside of the treatment room? And so all of that kind of higher level and comprehensive work really, really can make a difference no matter what you have, whether it's long-term, easily fixable, you can still make a change. And I fully believe that. So if you have any questions at all, I am always happy to connect. I'm always happy to answer questions. So email me, info@speakingboldly.com. You can ask me any questions about my personal experience, my journey, what I've done. You can ask me questions about your journey and whether or not I think speech or voice therapy or language therapy would be warranted for you, and how to kind of do that. And we can talk about every aspect of it, whatever you have questions about. So please feel free to reach out. I'm always happy to connect. And yeah, I'll see you guys here soon.